Hello and welcome to Dean Ornish Intensive Cardiac Rehab. My name is Kayla Mahoney and I am the program supervisor. I look forward to meeting you soon. The goal of today's presentation is to give you a little bit more insight as to the why behind this program model, but more importantly, explain how we're here to meet you where you're at in helping you achieve all of the goals that you set for starting this program. We will be providing you with patient access to a platform called Empower. The meeting that you have with one of our staff face-to-face and one-on-one will get you registered for this platform with an email login and password, which gives you access to your full nutrition curriculum as well as many other patient resources. We will also set you up with a binder with all of this information in print. That binder will include a phone list of all of our staff contacts. On the day that you begin exercise, you'll be paired with either a nurse or an exercise physiologist who will become your case manager. We also provide you with a name tag that we do ask that you wear at least in your first 2 weeks while we're all getting to know one another. And inside that binder, we have also provided you with access to our YouTube channel, which both of our sites contribute to. It will give you access to lots of additional information, group exercise classes, as well as stress management sessions. So what is Dean Ornish Intensive Cardiac Rehab? Intensive cardiac rehab is meant to reverse heart disease. We understand that not all of our patients have known blockages to their coronary arteries, but we do like to mention that there are very lofty goals that you need to try to achieve if you are in fact trying to accomplish reversal of known heart disease. These overall program goals include exercise for 180 minutes per week, which is a little bit more than the recommendation of 150 minutes that you may be familiar with. Nutrition education will be teaching you about a plant-based meal plan, meaning no animal proteins, and we will talk about that in future slides. Accumulating 60 minutes a day of stress management practice, as well as participating in discussion during group support with your peers or cohort members. Before we jump into talking about each of the 4 elements that you'll participate in, I think it's valuable to give you some examples of patient testimonials. These are from real patients who have graduated from our program. This program offers a wealth of information and resources. I never thought I would try some of the foods that I now make. I never thought I could learn to reduce the stress the way that I have here. The 4 components of the program resulted in my feeling better, stronger, physically and mentally. This transformation can be felt if you are open to the positive changes that this program can provide, and the program exceeded my expectations. So we like to think that folks really enjoy this program based on those testimonials. The first element that you'll participate in for the first of the 4 hours will be exercise. Our goal is to teach you everything you need to know about exercise so that you can ultimately become confident and independent in continuing exercise by yourself when you finish the program. So ultimately, we want to teach you about the appropriate intensity of exercise, where you're going to maximize benefits and also keep within safe limits. We like to look at this on a continuum. If we think about really vigorous high-intensity activities, you're not able to sustain these efforts for a long period of time, and the risk of injury is high. On the other end of the spectrum, which is your right side of the screen, we're looking at light activities. These are activities that provide caloric expenditure. They require you to move. You can do them for a long period of time. This is great because you're doing more than sitting, but it's not quite enough to achieve maximum health benefits. That sweet spot is considered moderate intensity activity. So how do we further quantify that? At baseline, we perform one of 2 tests with you. We'll either have you walk around our track and see how far you can walk in 6 minutes, or we'll do a maximal stress test on a treadmill at our Providence location. It doesn't matter which test you perform. We will be teaching everyone ratings of perceived exertion, or RPE, which is you're just rating the exertion level on each of the equipment. Does it feel light, moderate, a little bit hard? Can you hold a conversation with us while you feel like you're building up a sweat, but you're able to actually speak without struggling to get words out because you're extremely winded? If you do perform a treadmill stress test, we'll take the max heart rate that you achieve on that test and calculate out a target for you to exercise within. If that's applicable, we'll teach you exactly how to monitor your heart rate to ensure that you're remaining within your target. We also take a look at MET levels. One MET is you sitting down doing nothing. It's the amount of energy that your body requires to move forward with a certain amount of work. Everything in life has a metabolic equivalent. So we're able to actually look at how many METs you were able to achieve on a treadmill test. And that's how we determine the machines that you'll be using and the settings that we begin your exercise program at. We'll take blood pressure both at rest and during exercise every day, making sure that your blood pressure increases the way that it should. And then this doesn't apply to everyone, but ischemia means lack of oxygen, and angina would mean chest pain. This does not apply to everyone. Not all of you are experiencing ongoing chest pain following your cardiac event. But if you do, we ultimately set a ceiling that we don't want you to go beyond, because it's more likely that you experience these symptoms or a lack of oxygen to some of these vessels where you still may have blockages that have not yet been addressed. The second hour of the program is nutrition education, where we feed you a plant-based meal. We ask that you come with an open mind to sample all of the food. We make an effort to feed you foods that are familiar to you with plant-based ingredients. If you enjoy the food, you will be provided with a recipe each day that you attend. You also have additional recipes available to you within the Empower platform. So why plant-based? Again, we're looking at this also on a continuum where protein has an impact on your health. We place red meat as the most harmful all the way to the left side of the screen. In general, it's because red meat has the highest amount of saturated fat, and saturated fat is linked to the accumulation of plaque in your arteries and heart disease. We then take a look at chicken or poultry. In general, a little bit less saturated fat than red meat. If we can convince you to eat less red meat, which I'm sure your cardiologist has recommended that you consider, we are happy for you. This is movement in the right direction, and that's ultimately what we're trying to achieve here. Fish is even a little bit better than red meat and chicken, again, because there's even less saturated fat, and these protein sources have been found to be beneficial for preventing heart disease. A low-sodium Mediterranean-style diet with lean proteins, lots of fruits and vegetables, and whole grain sources has been endorsed by the American Heart Association as heart healthy. To improve your risk factors, movement in the right direction towards a Mediterranean and DASH style diet is wonderful, but we ultimately prefer plants in this program model because they have no saturated fat and are beneficial for reversing heart disease. So again, if you are trying to achieve potential of reversing your current disease state, plants are the preferred protein. But we're here to meet you where you're at and make movement in the right direction. So with regards to carbohydrates, not all carbohydrates are bad. Bad carbohydrates are pictured on the right. They don't provide you with much nutritional value. They're really high in simple carbs and sugars. They might taste delicious, but you're not getting much nutrition out of them. So we want to teach you about the right quantity and quality of carbohydrates that you're taking in, meaning the right portions. Portion size of the right high quality carbohydrates are going to allow you to lose weight, manage your diabetes, maintain your weight. These include fruits, vegetables, even starchy vegetables like potatoes at the right amounts, as well as whole grains like brown rice, quinoa, farro, oats, and legumes like beans, lentils, and peas. We really favor these quality carbohydrates because they have lots of fiber, phytonutrients, vitamins, and minerals. These compounds really help with a lot of bodily functions, which is why we favor them over soda, cookies, and chips. The third hour is group support. Group support is led by our social worker. Ultimately, the goals of group support are allowing you to connect with yourself as well as to others. You start and end this program with your group members at the same time. So you become very close to one another. The goal is to develop empathy, learn how to value someone else's issues, beliefs, and feelings. And ultimately, we're trying to provide a setting in which each person can feel safe, known, accepted, loved, and comfortable in expressing themselves. We'll go over a set of ground rules where we discourage conversation about politics, and we will continue to promote a mindset of whatever happens in Vegas stays in Vegas. It's a really impactful part of the program. Folks have a much easier time having conversations with folks that they can relate to who are going through the same thing that they are. And lastly, the fourth hour of the program is stress management. Stress is an independent risk factor of heart disease, so it's really important that we incorporate this into our day-to-day practice, even if it is for 3 to 5 minutes a day. Stress management is led by our stressorist, Laura, who is an exercise physiologist, yoga instructor, and expert in mindfulness-based stress reduction. We'll have you do some gentle movement within that session, which includes some stretching, things that look like chair yoga, moving and improving your flexibility and joint mobility in this session will transfer over to benefits of the exercise component, which you start with. You'll also learn different breathing techniques and other relaxation techniques, including guided imagery and meditation in this session. So, why all 4 elements? Why do I have to be here for 4 hours? That seems like a really long time. So this is a busy slide, but this is really the answer to that question. Each of the 4 element specialties come with their own list of benefits, listed on the left-hand side. Not surprisingly, exercise covers many of these. Exercise helps to improve your heart rate, your blood pressure, your cholesterol profile. It has benefits to improving your mood, like reducing depression, anxiety, anger, hostility, and stress. It's actually going to help your heart muscle to become stronger. It's going to become more efficient at carrying blood to your body as it becomes more conditioned. Then we move on to stress. Stress can also reduce your heart rate and blood pressure. Also lights up a lot of the mood-based categories here with regards to benefits. Similarly, group has the same benefits for improving or reducing issues with anger, hostility, depression, and stress. It can also help with blood pressure. And then when you move over to the nutrition category, it's pretty heavily focused on reducing your cholesterol, blood pressure. It can help with weight management, weight loss, improving your diabetes numbers. So the cumulative effect of participating in all 4 elements is greater. But nobody likes change except a wet baby. So ultimately, this is the slide. We're looking at another continuum. This is going to guide your experience here. Ultimately, what do you want to achieve? Are you here to get healthy, improve your cardiac risk profile, maybe improve your blood pressure and cholesterol? Are you trying to lose or maintain your current weight, manage your diabetes? Are we getting closer to the right side of the screen here where you want to reduce the amount of chest pain that you have, potentially eliminate or reduce medications that you're currently taking? Are you after prevention, avoiding another procedure from happening in the future? Or do you want the ultimate, which is reversal of heart disease? Know that if you want to achieve reversal, or you want that to become a possibility, that you need to put in a little bit more effort into trying to reach those lofty goals that we discussed in the very beginning. But again, Any small, long-term, sustainable change that you can make in the right direction will be beneficial for your heart health and will help to reduce your risk of developing further progression of your heart disease. That is really our goal in meeting you where you're at and making small changes to your lifestyle currently and helping just develop a foundation of building blocks that you can then continue to work on beyond program graduation. Thank you for listening to today's presentation. I look forward to meeting you on site and answering any questions that you might have in person. Have a great day.